Uh, After I help you put on the lens, so if it's not comfortable, you try to gaze down, try to look down, so you'll feel more comfortable. Okay, over there. Mm. How you feel? Just look straight. Yeah, if you don't feel comfortable, look gaze down. This time, huh? Ini hard lens. This hard lens a bit not as comfortable lah. If you compare with the if you compare with the soft. This one got degree, yeah. Slightly blur, right?
Okay, hi Jerry. Yeah,
Yes.
your setting is okay. You have started the recording as well, so
Yes,
that's
yes.
good. So please proceed, do your fitting assessment, do your application of the lens,
Yeah.
and then when you do the fitting, please share your screen and continue. I'll come back and then we can have a look together.
Okay. Okay.
Okay, okay. So you're fitting
Straight,
both
huh?
eye RGP anyways, right?
Yes.
Okay, okay. Go ahead. Yeah.
Fine. Okay. Look, kan? Ini ada bawah sikit. Tengok dulu sikit. Hmm. Itu saya mau pakai. Tangis saya. Yang kalau if the customer macam kalau disposable, mungkin dia punya power ada sampai limit lah. Kalau ini dia macam RX lah. RX punya contact lens. Atau macam kalau silau dia sangat tinggi, because disposable memang sampai macam 275 je kan. Kalau dia 400, 450 tu, have to use this type lah. Okay, come. Yeah, this one. Okay, bagus ni. Satu nampak. Meja tu mak bagi tinggi sikit lah, rendah sikit. Bawah sikit. Okay. Ini just look straight lah. Kamu boleh blink mata. Kamu boleh kalau tengok bawah tu lebih selesa kan? Ya, okey. Kamu tengok bawah dulu. Kalau saya tak nak suruh kamu tengok lurus, kamu tengok bawah saja. Okey, tengok lurus. Okey, tengok bawah. Okey, tengok lurus. Tengok lurus. Tengok lurus saja. Look straight. Sebelah left. Okay, look down dulu. Look down. Okay, look in the center. Look straight lah. Look straight. Okay, look down. Okay, look straight. Okay, look down. On the right eye again. Okay, look down. Look down. Okay, look straight. Okay, look down. Look down. Okay, look straight again. Okay, so look down. Look down. Okay, look down lah. Okay, now on the right eye. Okay, try to open your eyes. Look straight. Look straight lah. Okay, try to blink. Try to blink your eyes. Okay, look down. Okay, now left eye. Okay, look straight. Okay, try to blink your eyes. Okay, look down. You now, okay, look straight. Okay, try to blink your eyes. Blink your eyes. Okay, try to blink your eyes. Okay, look gaze down. Look down. Okay, look down. Okay, look straight again. Okay, try to blink your eyes. Blink your eyes. Okay, left eye. Okay, try to blink your eyes. Okay, look down. Okay, look straight. Try to blink your eyes. Okay, right eye. Okay, try to blink your eyes. Okay, look down.
Hi, Jerry. All okay?
It, I'm not sure. Okay, you help me have a look. Okay,
Yeah.
look straight.
You want to share screen easier for us to see? Yeah.
Oh, I not share, huh?
Not yet. Not yet.
I forgot to press. Oh,
It's okay. No problem. Yeah.
now already?
Yes. Okay. So let's have a look at this eye first. So what do you
Okay,
see?
right.
What is the parameters? Do you have the parameters with you for the right side? The lens.
This one seems for the horizontal. It seems all right.
Okay, but vertically it looks decentered down, isn't it?
Yeah. Inferior 2 mm.
Yeah, correct. So it's
And then okay,
definitely
yeah, going down lah. But the horizontal wise, I think right.
horizontal also is temporal, isn't it? It's all shifted up.
Sometimes, just now I saw was nestle. Now and then sometimes middle. Sometimes now a bit temporal. So a
So
bit.
that means it's moving too much, right?
Mm, 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 mm.
Okay, how about the post blink movement?
Okay, try to blink eyes.
Yeah.
Yeah,
So
I put moving lah, 2 to 3 mm, I think.
yeah, it is definitely moving a lot than what you need. So now you see it's shifted to nasal already. Mm. Okay, and how about your upcase
Movement type.
stability? Yeah,
Movement type is how?
smooth. It is very nicely smooth movement. There is no rotation, isn't it?
Jerky is what? Jerky is what? Is shaking.
Jerky is like, it
Look
will
down. Look
move.
down.
Mm.
Rotation is rotation. Jerky is will move. Oh, this one is
Yeah,
not moving, man.
it's moving, but it's smooth moving. It's
Smooth
not
moving.
wobble. It's not wobbling on the eye.
Or if it's wobble, then it's jerky lah.
Yes, yes, yes.
And then movement or speed. Okay, look straight. Blink eyes. How about movement? Average.
I would say it's a bit loose
Fast.
and it's fast lah. Yeah, yeah. This is definitely a very, very moving lens, right?
Yes, yes,
You,
yes. Okay.
yeah, you
Yeah.
definitely don't want your lens to move this much.
Okay, and then stability is ask them to look up and down, is it?
Yes, check whether your
Okay, look to
lens
the
stay within the limbus or
look
not.
look look to the nasal. Look to the nose. Sorry, look to the nasal. Look to the nose. Look over here. Look over here. For the horizontal seems okay. Look up.
Okay.
Look up. A bit out, I think. Coming out a bit. Look up. Look up. Yeah.
Yeah, it is definitely
Look down.
moving outside, correct. So that means there is no stability lah. Mm.
Okay, look straight. Okay, look here. So it should be inside the limbus, right?
It should stay within the limbus, correct. Yeah,
So this one is not stable, lah.
not stable. Yep, right.
Okay. So now left eye.
Fluorescing pattern. Do you want to have a look at the fluorescing? Then
Yeah.
you can
Yeah,
look at
sure.
the left eye yourself. Then I come back
Okay.
and have a look.
Okay.
Yeah.
Okay.
So let's apply fluorescein and see what do
Okay.
you see.
Okay, sure. You mean now?
Yeah,
Oh,
you can
yeah.
do fluorescein
Okay.
now.
I go take it for a sip.
Can.
Okay, look up. Okay, blink your eyes. Blink your eye. Blink your eyes, please.
Okay. So what do you see? Maybe couple of blinks more and then
Blink more. Blink. Blink.
and then get rid of the eyelids. Make sure the eyes are open wide. And what do you see centrally? What do you see? Is it touch or pulling in the center?
Blink your eyes. It's touching, I think.
Correct.
Because
Yeah.
because no fluorescent there.
Correct. Yeah. So centrally it's a touch. Mid periphery, how?
Uh,
Mid
Mid
peripheral
peripheral
area.
also touch also.
Is it? Oh, I see a bit of fluorescein at the mid periphery there. No.
You blink your eyes. Mid peripheral is actually the mid the center, right? Center of the
Yeah.
lens. Beside
No,
the
it's beside
outside from the
it.
central.
Yes. So about 5 mm
I think
from the side.
it seems
No more
seems no pulling
fluorescein
off.
already. Yeah.
Oh,
No more
I need to put
fluorescein.
more?
Yeah.
Oh, so fast. When you
Yeah.
look up,
It go off very fast.
blink. Blink your eyes. Seems no fluorescent again.
Yeah, why? Not you didn't put properly, I think. Maybe it's not enough.
Not enough.
Put a little
Look
bit
up.
more. Don't wet and just put it. Yeah.
Yeah, blink your eyes.
Yeah.
Yeah, look straight.
Got right. The fluorescein, see at
Got
the down there.
now
Hmm.
down there got that.
Yeah.
So but now
So
if I
I
open up the eye, it seems no fluorescent at all.
but you have to make the lens in the center.
Yeah, blink. Okay, find no more fluorescent again.
Maybe your fluorescein is very diluted, so it goes off very fast.
So put more or something.
Yeah, maybe you have to put a little bit more, but wet it less. Mm.
Blink up. Yeah, now I think much more.
Let's see. Yeah, see the difference?
So look straight. Oh, this one is seems now got pulling or not just now not pulling
Yeah, mid periphery is
because
centrally is touch, but the mid periphery is pulling.
center touch.
You see, centrally, you can see the pupil very clearly when the lens is in the center.
Yeah, so this
The
one the mid peripheral is pulling lot,
pulling, yes, yes.
and then this one the edge width. Okay, look straight.
Edge width is also mixing with the mid periphery, so I would say is higher because you don't have a clear edge. The mid periphery and the edge is actually mixing up together.
Oh yeah, true.
So yeah, what do you think is the fitting? Is it optimum? Is it tight? Is it flat? What's
This
your
one is steep, right?
steep? If steep is tight, that means the
Eh?
lens will move less. Here the lens is moving too
Because
much, isn't it?
oh, so now the central is touching, then the mid
Yeah.
peripheral is pulling,
Yes.
so it's a bit too flat lah.
Correct.
Because the central is touching lah.
Correct. Correct. Yeah. So it's a
Because
flat.
okay,
So it's a
and
flat
then
lens. So how will
okay.
you improve it? So if it's a flat lens, what are the parameters you will change? What modifications will you make to the parameters?
Make it steeper, like make it lesser, like 7.4. Now it's 7.6 lah.
So this is 7.6 lens diameter.
9.2.
Yeah. So
Look again down.
if your 7.6 lens is flat, you have to change it to a steeper lens. So what should be your next lens?
7.4.
Yeah, you will decrease the base curve or you will increase the total diameter, lah, right?
Either one lah.
Yeah. So 7.4 should be okay, lah. Yeah. Yeah. I think we can try lah later if we have time. But yeah, good. At least you have some understanding. So why don't you do your left eye yourself and then I come
Mhm.
back and then we have a look at it together. You tell me what you saw.
Okay, so I changed the right side to the 7.4 lah and see how is it.
Your left side first. Assess the left side first.
Left size. Okay.
You assess yourself first. I will check on the others and then come back
Okay.
and then you explain to me.
On the left lah.
Yes.
Okay.
Okay.
Okay. Tak terang. Look on the center. Blink eye. Control. Blink eyes. Okay, look down. And close the eyes. Okay, open your eyes. Okay, look straight. Okay, blink eye. Blink eyes. Okay, gaze down. Saya buat barang pengukuran gaze down je. Okay, look straight. Kalau saya jawab saya tengok ni, nombor tengok. Lurus. Kamu tengok saya tengok lain, kamu tengok bawah saya. Nanti saya balik, saya suruh kamu tengok lurus. Look down, say, look down. Okay. Look straight. Okay, blink your eyes. Okay, gaze down. Okay, try to blink your eyes. Okay, gaze down, gaze down. Okay, look straight. Okay, blink your eyes. Okay, gaze down. Okay, look straight. Okay, look to the temporal. Okay, okay look over here. Look here. Okay, look up. Look down. Okay, look here. Tengok sini ya, tengok sini, tengok sini. Okay, gaze down ya. Okay, look upwards. Okay, look, gaze down ya. Okay, look upwards. Tengok atas. Okay, gaze down, gaze down. Okay, look straight. Look straight ah. Gaze down, gaze down. Look straight. Okay, blink your eyes. Okay, look straight. Okay, blink your eyes. Okay, gaze down ya, good. Okay, look straight. Okay, blink your eyes. Okay, look down. Okay, look straight. Okay, blink your eyes. Okay, look straight. Okay, look straight. Kes tau? Ni makan. Hmm. Tengok dulu. Tengok dulu senang. Okey, tidak. Terus selesa sudah. Ya, tadi saya cakap, ya, kalau rabun jauh tinggi, macam 1,000 lebih kah, atau silau dia sangat tinggi, atau atau dia pakai biasa tu sangat kering lah. Karena ini dia lebih kecil, so dia masih ada oksigen boleh masuk lah. Dia tidak tutup kau punya mata lah. Tidak tutup permukaan besar. Ini permanen kan? Pakai setahun. Ah, oh, pegang ya? Jangan kuat ya? Bird mana? Nanti balik, panggil saya. Spina mana? Nanti bagi duit. Mac, suruh dia beli selain. Oh, tak selain ya? Yang, ah. Mungkin beli yang besar ya. Mungkin dapat dia ada satu ke dua ke tiga lah. Tak tahulah. Kalau ada satu, beli satu lah. Kalau ada kecil, beli kecil. Kalau tak ada, baru beli besar lah. Kalau ada beli satu-satu, beli satu. Kadang-kadang dia dua. Beli paling kurang. Karena umum pegang yang biasa ya kan. Tapi ini memang lain kan. Ini dia asyik mau try lah. Dia bukan macam soft condense terus pakai terus. Oh, okay. Ini dia mau macam fit sampai dia betul lah. Kan? Sampai dia macam selesa dengan dia tak bergerak. Dia punya fitting tu ngam lah. So tadi kita memang tengok dia punya fitting lah. Tengok dulu saja. Ya, pasal. Balik sini. Dah. Okay. Tak pedas lah. Bagus sini. Tengok lurus. Mac sini, Mac. Tengok lurus. Okay, tengok bawah tu. Okay, look straight. Look straight. Okay, look down. Okay, look straight. Okay, look down. Okay, tengok lurus. Okay, cuba blink mata. Okay, okay, look straight. Okay, blink mata. Okay, look gaze down. Dia tahu macam mana beli kan? Bukan dia tahu beli satu kah, dua kah, beli kecil. Oh, kalau ada lah. Kalau tak ada, terpaksa besar lah. Okay, look down, look down. Okay, look straight. Blink eyes. Okay, look gaze down. Okay, tengok sebelah sini. Tengok sebelah sini. Sini, sini. Tengok atas. Tengok bawah. Tengok bawah. Tengok lurus. Okay, tengok bawah dulu. Lepas tu sebelah kiri lagi. Tengok atas lagi. Tengok atas. Klik mata. Klik mata. Tengok lurus. Tak ada. Tengok bawah dulu. Tengok atas. Tengok bawah. Atur mata dulu. Okay, tengok lurus. Tengok atas. Tengok lurus. Tengok bawah. Tengok sebelah. Ini tak? Dia terkeluar. Tengok bawah dulu. Ada ni. Apa sudah bangga dalam? Sampah. Tidak. Hey, Nicole. Regarding Lee Cooper, I see the stock book. Mereka selalu ada tulis back stock tak? Kamu tak nampak tak? Kamu bila cek Lee Cooper. Hari hari apa? Dan kamu tak tengok yang semalam punya? Ha? Tapi saya nampak banyak Lee Cooper mereka ada tulis back stock. Ah. Mungkin sampai hari itu mereka belum kira. So kamu nak tengok balik yang semalam lah. Semalam mereka tak buat. Semalam tu maksud apa? Yesterday? Sunday? Tengok. Kamu check. Ambil gambar untuk saya tengok. Ahad tu apa? Hari apa? Eh, so hari apa? Because I always see them ada tulis 17 pun ada, 18 pun ada. Every day got apa? Kung itu hari apa? I know. Check the date now, kan? Boleh, boleh. Beli beli tiga. So later you check for me ah. You answer me, Nicole. 等一下你帮我 check 一下啊，你帮我 check 那个 Nicole，因为他有一天他 check 那个 Lee Cooper，他 transfer 到20多副出去。OK，他是讲我们算没有算到 backstop，那没有填到，因为可是我们很多天都有填到，可能就那天没有填到，或者你 check 一下他几时 check 那个 Lee Cooper，然后你看他前一天有写到 backstop 吗？你懂我意思吧？就是他 backstop 没有看到 backstop，直接全部 transfer 全部掉。你帮我 check 一下，到底是他没有 check 前一天吗？还是那天没有 check 到啊？你看是几时 check 那个本？可是好像要 check 完 Mavic 先啦。可是我刚才要 check 他这边不懂一直 check Mavic。对，他几号 check 那个本？他几号 check 那个本？几号？你懂没？啊，不是要看他那边，你这边看不到。Ini pernah buka ini ya? Oh, pernah buka ini? Ya, dia ada satu kuning tadi. Buka kuning tuh, terus tuh masukkan ya. Terus, terus. Oke. Tengok lurus. Okay, look straight. Okay, blink your eyes. Okay, all right. Okay, look. Look here. Look here. Look here. Look up. Okay, look down. Gaze down like that. Tengok atas. Okay, blink your eyes. Blink your eyes. Okay, look. Blink your eyes. Okay, gaze down like that. Gaze down. Okay, look straight. Okay, look up. Tengok atas. Okay, blink your eyes. You blink your eyes. You blink your eyes. Okay, just gaze down. Okay, relax the eyes.
Okay, looks like I'm just in time. Hey, is it the video playing or what? Yeah, I think Jerry, you're on mute. Cannot hear you if you're talking. I saw you just now, but okay, let me send you a request. Okay,
Yeah, yeah.
can,
Okay.
can. Okay, so how
Uh,
you check on
okay,
the left
so,
side?
okay, left side. No more fluorescein. Okay, fluorescein, we drew to the white one clear first.
Yeah, okay, yeah. How's the lens centration and what do you observe?
Uh, this one, uh, is, eh,
What is the base curve
just,
again, for this one?
this one is 7.8.
7.8, okay. 9.2 Oculus also, isn't it?
Yes, yes. No, Boston, yeah, Boston.
Boston Oculus, okay. Okay, all right. So let's see the centration and everything. What do you explain? Explain what did you observe?
Okay, look straight. This one, it's towards the temporal.
Yeah, it's moving towards temporal and inferior. But if you see the post blink, do you observe anything? Ask
Okay, try
patient
to
to
blink.
close, open, and see.
Sliding down, lor.
Yeah,
It's
sometimes it
smooth.
has that apical rotation, you see.
Got that. Okay, try to blink again.
So sometimes the lens rotates.
Oh, okay.
Not
Got
always,
this.
but there is sometimes.
Oh, okay, okay. So what does that
Mm.
mean? If it's a jerky and empirical rotation.
Yeah, I will say this is apical because the lens is
Oh,
moving
yeah,
a bit.
it's turning towards the left side. The right side.
Yes, it sometimes left, sometimes right. Most of the time is right lah, but it's some it is definitely apical rotation. I would mark as
Oh,
apical rotation.
okay, okay, okay. And
Mm.
then yeah, and then it's a
Stability,
fast stability is I think is quite okay. Okay, look over here. So it's
cross the
okay,
limbus a little bit. Okay,
okay, look here. This for this side,
just
okay,
okay lah. Mm. It's crossing
this one
limbus also.
is a bit lah.
A bit, yeah, yeah, a bit only. Yeah. How about when the
Yeah,
patient look
look
up?
up, look up. Also a bit.
Yeah,
Oh,
yeah.
this this is also consider coming out lah from
I
the
I
brown
I
color.
would I would say that yeah, it is coming out of the iris and the limbus there. So I would say it's not stable lah. I
Okay.
would still consider it as unstable. Yeah.
Uh-huh. And then this one, yeah. So I need to put fluorescein now.
Yes.
Look up.
Mm. Okay, a little bit too much, but let's see.
This one is I think it's a bit the fluorescein pattern is on the bottom. Okay, blink your eyes.
Yeah.
Okay, blink your
So
eyes.
you need to ask patient to look down and open the eyelid. So you have the lens in the center.
Sorry, how?
You manually open your eyelids. Yes, and then you push the lens in the center. So then you will see. So centrally you can see there is a
Touching.
centrally is there fluorescent? No, yeah. So there is touching. Mid periphery,
Pulling.
edge.
Uh, Edge is the top is about 1 to 2 lah, but the bottom is mixed up with the mid peripheral, right?
Yeah. Yeah, yeah. So I would say edge clearance is also higher. Because it's too much edge clearance.
On the bottom.
Normally about zero point 0.5 to 0.75 mm is what you need. But this one is definitely more than that, isn't it?
But the top part I think should be okay, right? The top, the superior.
It is okay because the lens is decentered down. Once you put the lens
Oh,
in the center, then it is still not good, isn't it?
And then I got actually okay, yeah.
Mm. So I would say that this lens is also flat lah.
Yes, yes, yes.
Same.
This one is flat. This one I
Uh,
purposely make it because the patient Fat K is 7.6, so this one I purposely make it 7.8.
You purposely make it okay.
And
Okay.
then for the right side, just now, actually, I did change to 7.4 already.
Okay. Is it become better?
Is the image on the right side of the screen? Can you see? This one
Okay.
is seems steep.
Yeah, so maybe 7.5 in between will work lah.
So now need to try 7.5.
If you have the time,
Yes.
but I need you to do over refraction first. Have you
Oh,
done over refraction already?
not yet. Not yet. So
I
this one,
think
I do the over reflection on both eyes lah. Yeah.
yes. Do over refraction first, and then if we have the time, we change. If not, it's okay.
Okay, understand.
Can ah? Okay.
Okay,
Okay. Yeah.
okay, relax. Okay, ini nampak? Tak nampak juga. Sangat blur. Ini okay. Ini pun blur. Ya. Terus nampak. Aku bintik putih ya. Oke, tengok itu bintik putih. Tengok itu bintik putih ya. Tengok itu buat tak lah. Oke, ini apa? Ini apa? Ini? Mhm. Semua? Hmm. Ini? Kenapa? Kenapa? Oke, artinya masuk ini jelas kah? Kabur sikit. Kabur, buka jelas. Kalau masuk ini, lebih jelas kah? Kabur sikit. Jelas sikit. Ini apa? Kalau masuk ini, lebih jelas kah? Kabur sikit. Buka, buka aktif QR. Masuk, buka. Masuk jelas sikit. Bagian apa? Masuk ini, jelas sikit kah? Kabur sikit. Buka, masuk. Ini beda. Kalau masuk ini, jelas. Ini kurang ah. Oke, boleh bacakan? Ini memang kabur kan semua? Nampak tak? Ini, ini nampak ya? So ini, jelas kan kabur sikit. Ada beda. Mana bagus? Buka kan masuk? Sama. Yang atas tu nampak? Ini apa? Ini, 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 ini. Mana bagus? Buka, masuk, maaf. Kalau masuk ini, kalau masuk ini, oh, boleh lah. Kalau masuk ini, blur sikit. Buka bagus lah. Kalau masuk ini, blur. Buka, tapi kalau sama lah. Tapi masuk ini memang blur lah. So tadi masuk ini pun, masuk ini blur sikit. Lima merah, lima hijau, mana lebih jelas? Atau sama? Hmm. Atau which one? Which one is the red, green on the red or green on the, five on the red or five on the green? Sebelah kiri? Sebelah kanan? Nah, masuk ini?
Okay. Hi, Jerry. You're doing over refraction now, isn't it?
Ya, ya.
Okay, finish up first. Yeah.
Almost ya. Nah, masukkan mana dulu? Hijau dan merah. Hmm? Kalau ini sama. Kalau ini hijau. Kalau masuk ini balance. Tapi masuk ini tadi macam blur sikit ya. Buka, buka jelas sikit. Okay. Relax eyes. Look down. My handphone dulu. Boleh. Kau hari tu Monday, kamu dekat sini kah hari tu? Monday kamu ada kerja? Sini ha? Tengok. Oh, okay.
Okay, so are you done with your over reflection already, right?
Yes, yes.
And you remove the lens already?
Okay, can we move on?
Can
Okay,
remove. Yeah, we have assessed of
okay.
it. It's just we will discuss about the over reflection later with everybody lah. Huh?
Can.
So you remove your lens and then you can actually uh, uh, what I mean stop sharing
Hmm?
and you can meet me in the main room lah once you remove the lens. No rush. We are waiting for Mr. Steven also, so there's no rush.
Okay.
You remove the lens, discharge the patient, and then we meet you in the main room.
Okay.
Okay.
Nanti, nanti pukul 1 terus check kau punya tu. Pukul 1 lah. Kau punya after buka sudah set lah. Okay. Kau lihat terus. Hmm. Hmm. Eh, jangan ni ada satu barang buat om. Oh, ini tanda itu nampak kehidupan. Eh, Jadi saya perlu kamu dekat sana dalam 20 menit. Mungkin 1:20 kita pergi lunch lah dengan cousin kamu. Makan sekali. Oh, so nanti dia pukul kita habis makan sampai dia lah. Atau atau dia mau sambung juga. Sambung apa? Kamu tahu? Kau makan dengan mereka? Oh, oh. Mungkin kamu dalam 1:30 lah. Jadi, so dia mau sambung 1:30 kan dia mau nak sambung pukul 2:30. Bukan, yang ni dia mau 1,5 kan 2,5. Hmm.
Eddie is Sarawak
Oh,
also, isn't it?
both from Sarawak.
Oh,
Then
Sarawak. Okay. I always thought that he's from Sabah. Don't know why.
Best three got Sarawak and Sabah.
Ah, okay.
Uh,
Already got batch three, ah.
yeah, best
Wow.
three bridging is on the way. Man.
Batch two done, ah.
Best two already start their acceleration course.
Batch two,
Okay.
they are in the second week. I think today is their last day in Segila. This is their week 2.
Week two means first semester only, ah.
Yes.
Week two, week
Wow,
three already.
!aiyo!
Week 2 today.
Oh, I see. Last day lah.
Yeah. So yeah, I think last day, I think the labs and the briefing lah, the first 2 weeks of the briefing,
9% only.
9.
Huh?
Yes.
9%, ah.
Yeah. That's why
Yo.
the survey dissertation is easy lah because he interview ourselves got 13, there got 9, and she only need to interview for 22%.
Okay.
I
Let's just wait for while Mr. Stephen finishes, and then we can quickly have a
All
quick
right.
discussion. Huh?
Sure. So, Mr. FD, when will we getting our like exam tips?
Every
so
day.
if you say don't need exam, don't need exam.
That's great.
Exam definitely need, but you are getting the tips every day anyway. Whenever you join the session, is all tips only, ma. Any okay, Mr. Stephen, all okay? Any standing?
Seems
Are
like just
you are muted, I think. Can you unmute? Yeah. Let me put him on unmute.
Unmute. Yeah, can you hear me?
Yes, can. All okay?
Right center got slight standing.
Nice standing, because of the flat. Okay. Yeah, it should be okay.
The right side. Left one supposedly no standing left one.
Okay. All right. Okay.
So shall I
Okay.
at the form the standing on the right side.
You can record at the bottom anywhere just for recording purpose.
After lens remove
Yes. The lens remover. Okay, so let's have a quick round of our discussion just to see if everything is okay. So we start with Neo. Neo, one eye he fit with RGP and one eye soft toric. Okay, the RGP eye looks quite nice. The fluorescent pattern was quite good, no problems. But the lens was slightly smaller on the eye. So I think we decided to increase the diameter. Otherwise, we will maintain everything there, but quite comfortable. Patient also, I think 4/5, he rated
Yeah, 4 or 5.
4/5. And also the over refraction was very tally to the patient power. The patient is 275. Contact lens is -3 and over refraction was 0.75 plus, 0.25 plus.
Plus, yeah.
Yeah, so it's all tally lah. So we will accept it and we will finalize it lah. The left side was toric. Again, the lens was moist. And the only thing is that the over refraction was a little bit not tally lah. In this case was slightly over minus. But we will have to, over refraction, we still need a little bit more practice to make sure the refractions don't over or under minus. But fitting wise, I think okay. Push-up test was good. The scribe mark was at 6 o'clock, less than 10-degree rotation. So we did accept the fitting for the toric as well. And the patient also has astigmatism. VA was maintained, good VA also, 6 over, better than 6.6, right?
4.5, yeah.
So very straightforward case. Okay. Any questions? Okay.
No, quite. Yeah.
Okay, and then moving to room 2, Kevin, soft toric on one eye was very tight, about 65 to 70% tightness. The lens was not having much of a movement as well on every case. And rotation wise, there was an anti-clockwise rotation about 5 to 10 degrees. But because the lens was tight, we definitely reject it because the movement was not good. Same thing happened on the other side, but the other side was even tighter. It's a spherical profit lens, and then the push-up was almost 75 to 70%, very tight. It was moving very little. So again, we have to reject. So both eyes reject, both eyes were tight fitted. So our learning is if you have a tight fitted lens, you have to modify the base curve or the total diameter to make it loose, right? So how will you modify it? You will have to change the base curve, either increase or decrease. What will you do to do? If the lens is tight, you need to make it loose. So what will you do to the base curve? Increase or decrease?
Increase, make it like more 9.0 or 8.8 like that.
Yeah, so it has to be increase the base curve lah. Huh? Okay. Okay. So yeah, straightforward again lah. Both eye soft, both eye reject, both eye tight.
And one question here,
Yeah.
how about the diameter wise? If I change from 14.2 to 14, it will be getting loose or
Yes.
getting loose,
So increase the base curve will make it loose.
increase the diameter.
Increase,
That's right.
increase. It's the opposite way lah.
Okay, understood.
Sorry, Mr. Steven, you were saying something. Sorry.
Increase the base curve, flatter lah, make it flatter.
Make it loose. Yes, make it flatter. Yes.
Because we have to consider the different brand as well, right? If
Yes.
different brand that have different like diameter, then I need to reconsider again with the
Yeah.
diameter.
Yeah. But most of the time is for soft lenses don't have a much of an issue unless the patients have a significant cornea astig, then only lah. Spherical cornea usually not much of an issue because soft lens usually flex on the cornea. So not much of an issue. Yeah.
But and also because of over minus, so patient cannot see until 6.6 as well.
Yeah. Patient was almost -1 something, isn't it? The power.
I
Habitual power.
think minus 1.5, but basically her eye just plano to minus 0.25 for me.
So this patient is plano, but he fits 750 lens also.
Yeah.
So you will have a difficult time in over reflection. So in real scenario, it won't happen, lah, of course, right?
Yeah. True.
Okay, good. Okay, so moving to Jerry. Jerry, your over refraction, we haven't calculated. So just have a quick this thing. Both eyes were flat, 7.6, 7.8. Both lenses were flat, isn't it? Central touch, mid peripheral pooling, and everything. So what is the patient power, habitual patient power?
Which one? The expected, the over refraction?
No, the patient refractive error.
See, this patient no error.
Oh, this patient
error.
is no error. Okay,
Ah.
so patient is a e-metrop lah, so plano lah, right?
Yeah.
So for plano eye, if you put a -3 lens, your expected over refraction should be
+3.
+3, correct. Okay, but what was your obtained over refraction?
Right side +175, and then left side +300.
Okay, right side was +175. That means that there is a +125 TLP. Yeah. So same thing, plus TLP is basically steep, but your fitting was actually flat. Or are you telling me this was the 8.4, 7.4 lens you
This one
changed?
is 7.4.
So the 7.4 lens was steep, correct? Because first you fitted a 7.6 was flat. Then the same eye you changed to a 7.4 which showed steep. And the over refraction you are telling me is of the steep eye, correct? Steep lens. Yeah, then it makes sense. So 7.4 lens was steep. Okay. 7.4 lens was steep. The patient is plano. You put a -3 lens, you should get a +3. But you are getting a +175. That means there is +125
TLP.
TLP. So plus TLP is steeper, right? How about the
Yes.
other side? The other side was 7.8 lens, which was again flat,
Yeah, flat.
right? So patient is
Yes.
still plano for the left side.
Yes, panel also.
Okay, and then your lens was -3, so your expected again should be +3. How about the obtained over refraction?
+3.
Okay, so here it doesn't tally because here it shows that TLP is 0.
Yeah.
But actually the fitting was flat. So there is either the patient power has changed, maybe the original refraction is not plano anymore, or your over refraction, you need to push in a little bit more plus. So then only you will have a tally. So that is the left eye is not tallying 100% lah, but the right eye definitely tally lah. Huh? Okay.
Mhm.
So what is our learning from this? Because if let's say your 7.8 lens is flat, what modification will you make to make the lens better?
Make it steeper.
Okay. Yes. So how will you make it steeper?
7.6.
Yeah. So it's either you will decrease the base curve or
Increase the diameter.
is the total diameter. Okay. So that is what you have to learn. Understand. So because 7.8 was loose, flat, I will decrease the base curve until 7.6 perhaps and then see, or you will increase the total diameter.
Yeah.
Okay.
Yeah. I got one question.
Yes. Yes.
Okay, so when I order the lens, I will example the base curve and the diameter is correct. So when I
Mhm.
order the lens, do I order -3?
No, you will order in this case, both lens are rejected anyways, right? But let's say you have a patient who has a -3 trial lens,
Yeah, my
okay,
trial lens is -3, yeah.
and the over refraction is +2. Example, -3 trial lens, over refraction +2. Fitting all okay. You accept the fit, everything is okay. So your final lens should be -1, not -3.
Oh, so we'll check. Can you repeat again? So trial
Yeah.
lens was
Trial lens
-2,
-3,
-3. Trial lens -3.
over
Over refraction
refraction +2.
+2. So
Fitting all good. So you want to finalize the lens, it should be -1. So your final lens, you will order -1 power.
if, for example, there's a TLP,
Then you have to change the
example,
lens. You have to change the lens first. Your diagnostic lens must change. So
so
you
must
can,
change until perfect base
yeah,
curve and perfect diameter, then we can order
yes,
accordingly to the over refraction
yes, yes.
and the trial
So
frame, trial lens.
your target is to get TLP 0. Once your TLP is 0, then your calculation very easy.
Can we get like TLP that we have some like maybe a bit 50
Yeah.
degrees? We must make it until 0.
Plus minus 050 is acceptable. In some cases, usually in high minus, you tend to fit a slightly steeper lens because you see a high minus will be slightly thicker, so the lens will have some weight. So practitioners tend to fit a slightly tighter lens in a high prescription. So if you fit a slightly tighter lens, you will leave some TLP there. So only in special cases, in normal fittings, is better to get TLP to as close as 0 lah.
Because the myopia, high myopia, the cornea is thicker. So need
The lens, the contact lens. Higher
the
the minus, the contact lens will be thicker, so it will move down on gravity. So we tend to make it slightly tighter lah. We tend to fit a bit steeper lah in that case.
so it won't drop down lah.
Yeah.
Okay.
Yeah, so those are in some cases, even in high astig, you will tend to fit it slightly tighter to just get a better alignment. But always you have to make sure like even if you fit tighter, you do not want to compromise on the cornea health. You do not want to fit so tight that the imprint will be there on the lens, on the eye. So it's a very safe area you have to play around.
Okay.
If fit steeper will cause over minus or not
Yes.
for high myop?
Yes, it will cost. So you will sometime have to order a slightly higher power lah. Even though your patient is -8, for example, contact lens power require -8, but because you have fitted a slightly steeper lens, you may have to order 850 just to compensate for the fitting change you have made yourself to make the fitting better lah.
Oh, okay.
So
That
sometimes
means,
only.
sometime only.
Yeah,
It's because over minus for near is not very good, right?
yes. Yeah, that's what's my next point. Without affecting the vision. So that's why you have to be very careful. Corneal health and vision plays an important role. So if the patient is 37, 38 years old, you give him over minus, definitely he's gonna come back and say near is a bit difficult now. So you have to be very careful. You have to hit a perfect balance. Ideally, you must get a TLP 0, you must get a good fit, ideally. But in some cases, yeah, you might have to do some optical as well as these modifications, fittings to get your proper fitting. I mean, to get the proper outcome, not the proper fitting, but to get proper outcome. Yeah. Okay. So that's Jerry lah. And then the last one, Mr. Steven also fitted both eye RGP. So both eyes were flat. Right eye was quite okay, acceptable almost. But the left eye 8.1 lens was definitely flat. But yeah, we calculated his TLP and everything. It doesn't tally. So we have decided to do the refraction for the patient first lah.
Ask question.
Yes.
Yeah, do I need to divide the astigmatism by 2 and add back to the sphere power? Let's say this patient do a quick subtractive reflection. The
Mm.
power minus 125, the cylinder is 50. So the expected power should be minus 125. Astig is 50 divided by 2 is 25 25 add back to the 125, that means it's 150. Shall I do that?
For RGP, no. You only do spherical equivalent if the RGP in the RGP lens if your astigmatism is more than 150. We
Oh.
expect the RGP lens to help mask astigmatism up till 150 diopters. That is what we want.
Help until 150.
Yes.
So what happened with let's say help until minus 150 astigmatism lah.
Yes. So we don't do spherical equivalent. We just focus on the sphere only.
So what happened, let's say the power more than 150 astig?
Then you have to see where is the astig coming from. Is it cornea astig? If it is cornea astig, then you may need to fit the toric RGP
Muted
already.
muted. Cannot hear you.
Your phone is ringing. Okay. Now you can hear me. So what I was saying is, if let's say your astigmatism is more than 150, you want to check what is the source of astigmatism, whether it's a corneal astig or whether it's an internal astig. If it is cornea astig, then most likely you will need to fit with the toric RGP design already. Okay, if the astigmatism is more than 150, which is corneal, most likely you will need to fit toric RGP.
Oh, you mean
Ah.
toric RGP or fun toric or what?
Usually, if cornea astig related is back surface toric.
Then
Yeah.
go for back toric lah.
Yes, you will have to go for back toric. Yeah. So it depends on what is the site or what is the source of astigmatism. Is it cornea? Is it internal? Is it over-refraction? Sometimes you will have fitting related induced astig. If your lens is not fitted well, you might induce astig.
But if internal one, so internal astig, so we need to fit for bitoric, isn't it?
Front surface or bitoric. Bitoric is both surface toric. So let's say your patient has 4 diopters of refractive astig. Example, patient 4 diopters of refractive astigmatism. But the topo or your kerato only 2 diopters of astig. So that means 2 out of the 4 is coming from the cornea. The other 2 is coming from internal. In that case, you might need bitoric. So you need back surface toric for the 2 diopters of cornea astig. And then the remaining 2 diopters, you need to give front surface. So then it become bitoric.
Bitoric is for those power is more than 1.5 or and not because of the cornea astig.
It has, because bitoric is back and front, both also toric. So there is a component of cornea astig plus additional refractive astigmatism. Both.
Both lah.
Front surface is when your cornea is spherical or very little astigmatism or toricity, but the patient have refraction, which is astigmatism. So let's say, for example, you have a refraction of about 3 cylinder, but when you do your keratometry, only 1 cylinder. So 1 cylinder on kerato means cornea astig is 1 diopter, right? So for that 1 diopter of corneal astig, you may not need back surface toric. But because there is 3 diopters of astigmatism, patient will not see. So you need to give astigmatism on the front surface. And then you need front surface toric. So there is different situations. But that is a bit more advanced already, because when you go for toric fittings, it's more empirical based. You will have to do your keratometry or refraction, and based on all those results, only you empirically order, and then you get the lens, you do the fitting. Based on that, you modify. Because very rarely you have supplier who has toric RGP trial lens sets.
So I repeat what you say. Let's say the astig power we got minus 300. Then keratometer is minus 2. So internal astig got minus 1, isn't it?
Yes.
So this power I go for back toric.
Back toric definitely will be needed.
Remaining one got 100 so I do a front toric 100 astig lah.
Yes. Then it become bitoric.
Then become bitoric lah.
Yes.
So I got another question. Just now I see my lens, the left one. Do I need to record the very slight dumbbell shape? Do you notice that?
I would say that there was too much fluorescein, so I don't want to say it's dumbbell shape until I have a sufficient proper fluorescein, because just now the lower lid there got too much fluorescein. So I don't know whether it was because of the excessive fluorescein or because it was a real dumbbell shape.
Oh, I see.
So you want to make sure on that.
Okay. Just now I actually did check when the fluorescein lesser still got a little bit the middle one less is touching a bit.
Yeah. Then yes, you can say dumbbell shape. And then dumbbell shape is usually when the patient's cornea astig is higher. So again, you need to relate back to your cornea astig whether the cornea astig is high or not.
Yeah.
So this is dumbbell shape lah. If you haven't seen, this is dumbbell shape. If you see my background here, just now the first group also I showed this because one of them have dumbbell shape. This is dumbbell shape, very obvious. So you have this area which is touching. So one meridian you have touch, the other meridian you have pulling. So this
very obvious. And one is not so obvious.
Yeah. Not so obvious. Yeah, this is very obvious. This is dumbbell shape lah. If for your information. So one meridian is touching, one meridian is pulling. So why does this happen is because the contact lens is spherical or aspheric, right? No toricity, but the cornea is toric. So one meridian is touching, one meridian is pulling.
Let's this customer, the right side is minus 150 with asterisk minus 50 lah, let's say.
Mm.
So I get the over reflection is plus 150. Plus 150, the power is minus 300. That means TLN power is 0, correct?
Yes.
Yes,
Yeah. So TLN's power is based on the difference between your over refraction and your expected over refraction.
yeah. So the left one, let's say the short-sighted is minus 175. Then I get overreaction plus 150. 175, 150, that means I over minus, so minus 25. Lo.
Yes.
Minus 25, that means
Plus 25 TLP.
that means it's too flat. Let's say
Steep. Plus TLP is steep.
let's say the power is minus 175.
Patient power is minus 175, is it?
Over reflection I get is plus 150. So the is minus extra minus all 25 ma. Minus that means
One more time, the values again. One patient power is minus 175, correct?
asterisk is 0.75.
Forget about the asterisk because it's less than 150. So we don't talk about asterisk. We focus on the sphere. Patient power, patient refractive error is 175 minus, correct?
Over reflection is plus 150.
Okay,
So-
over refraction is plus 150. Okay.
So it means
Contact lens power is minus 3.
connect power is minus 3.
So in this case, if assuming everything was okay, your expected over refraction should have been plus 125, isn't it?
Plus 125.
Okay, but you are getting plus 150, correct?
Yeah.
That means you are getting additional plus 0.25, correct?
Additional plus.
So why you are getting an additional plus? Because there is a minus 0.25 tear lens power.
Oh, I see.
So minus tear lens power means it is flat.
Minus all 25, that means flat lah.
Minus is flat. Plus is steep.
Minus TLP is flat lah.
Yes. Plus TLP is steep. Minus TLP is flat. So I think when you review back our discussion, we did discuss this during our tutorial and also I think in one of our live sessions. I think just go back and see. You will have some examples in my recorded session as well.
Okay.
So just remember, minus TLP is flat, plus TLP is indicating it is steep.
Plus TLP means steep.
Yes.
Oh, okay. Yeah.
Okay.
Okay.
So yeah, so just have to
Question
practice
from
a little bit more on over refraction. Sorry?
9 to 11 tomorrow. I check with Kevin.
Yeah. I already changed on the timetable. So tomorrow morning, yeah.
When I finish, I leave early a bit.
Yeah, can. If you done, no problem. Yes, okay.
Okay.
So
I got one question.
yes,
Just
please.
now you give an example for bitoric, right? Let's say I find out that this patient have 400 astig, okay, and 200 from cornea, 200 from reticular example. So for bitoric, how do I order from the supplier? I have to tell them 200 or
No. Their calculation.
automatically?
They will give you the calculation to do.
Okay.
They will tell you. So there is a few calculators which are there. You will have to exactly calculate what is the base curve for the back surface, for the steep and the flat meridian, and what is the curvature for the front surface for steep and the flat meridian. It's all online lah. You just need to put the patient's keratometry reading. You need to put patient refractive error and vertex distance, and then automatically it will calculate for you.
Oh,
What is the curve you need to make?
how to calculate the front curve to meridian and back curve to meridian? Use topo.
Flat and no, for
Hmm?
you topo, you will get the cornea ma.
Uh,
So the residual will be internal.
mm-mm. Yes,
So
correct.
they will based on that values.
That means I have to key in both front and back
Only the
to
flat
make
and steep for the back.
for the back. You miss for the lenticular, is it?
For the cornea. You cannot
Cornea.
measure
Okay.
lenticular ma.
Yeah, yeah.
Only cornea. So
Oh,
the remaining one is considered internal.
or they will automatically calculate.
Yes.
Oh,
Yes.
okay.
Okay. Or the other
Yeah.
way, what people do is they fit the back surface toric first.
Mm.
And you do over refraction, how much you need. Okay, I need additional 2 at what axis? 150. Then they will generate 150 axis minus 2 and send the lens to you. So
Oh,
based on your
okay.
over refraction also, they can generate the power.
Okay.
Yeah. Okay, good. Any other question before we wind up for today?
Nothing so
No.
far. But so good.
Okay, good. So yeah, recap on these things and also our live sessions, I think should be good lah. Huh? Okay, yeah, let's take picture because Kevin's first session today.
The seconds.
Okay, maybe you both, Kevin and Jerry, want to rotate your camera or not so we can get the full view.
Like this.
Yes. Okay, be ready. Give you count 1. Okay, wait. You can hold like selfie lah. Hey, why? Too hungry already, isn't it? Cannot hold the phone. Okay, 1, 2, 3. Yeah, I think it captured. Okay, let me just double check. Okay. See where it went. It is somewhere. Okay, have. Okay, so later I send.
Share.
Okay, take care. See you guys.
Thank you.
Some of you
Bye-bye.
tomorrow, isn't it?
Yeah.
Some of
Tomorrow.
you tomorrow. Okay. Take care. See you. Bye-bye.
Bye.
Right.